Hey everyone, welcome back to Pharmacology. This is our third lecture, and this one is going to be talking about some other organ-specific drugs that we use in various conditions. There will be part of this PowerPoint that will be done live in my current class, so just so you know, if it sounds a little different, that's why. Okay, here we go. We're going to start off by talking about liver disease. So hepatoprotectants are really the primary thing that we use when we're dealing with patients with liver disease. There's not a whole lot we can do to repair it, but we can help to prevent further damage to the liver and kind of optimize its function as much as possible. And we do this primarily through hepatoprotectants. So S-adenosylmethionine, or otherwise known as SAMe, is one of the most common supplements, I guess you'd call it, that we use to protect the liver for patients who are having liver problems. Silymarin is another one, that's milk thistle. There's a product out that actually combines these two supplements, so it's a really nice one to use if you have access to that. So these are protective to hepatocytes, otherwise known as liver cells, of course, due to their antioxidant properties. I'm sure you guys are all familiar with antioxidants, and they help basically to keep cells healthier, let's just say that. And they support normal cellular function. They're considered to be nutritional supplements, so these are not drugs in the classic sense. There's also a class of drugs called choleretic drugs. The one that you're going to hear about and that you'll see used is ursodiol, also known as ursodeoxycholic acid. These stimulate bile flow. So in those patients that might have bile stones or sludgy bile, the stuff's just not moving properly through the biliary tree, which, as you know, is called cholestasis. If you have a patient with cholestasis, sometimes the vet will prescribe ursodiol to kind of help get that bile flowing again. It was originally derived from the gallbladders of bears, which is where the urso came from. So just a little interesting note there. And again, this drug functions as a cytoprotective agent and an antioxidant, and it is well tolerated in animals. You won't see a lot of side effects or anything with this drug, so it's one of those, well, you might as well use it if you have an animal with potential gallbladder or biliary tree issues. Then we have our antifibrotic therapy, not used very commonly in vet medicine. I don't see a whole lot of liver fibrosis in general, and that's largely because, you know, if you think about what causes fibrosis in humans, well, primarily it's alcohol, and we don't really have that problem in animals. But, you know, there are other causes of cirrhosis. Basically, in cirrhosis, the liver cells kind of start getting replaced by fibrous tissue, so you get a decrease in functional liver mass. So what we can do is we can use antifibrotic therapy to help try to slow this process and to slow the progression of liver disease. The one that is sometimes used is colchicine. And again, this is not one you'll see all that commonly, but it is around and it might be used in certain cases, so just be aware. There are some side effects to it, of course, so anorexia, vomiting, diarrhea, sometimes hemorrhagic diarrhea, and bone marrow suppression. So basically, we choose to use this only in animals who really need it. I'm going to briefly talk about metal chelation therapy, just because there are certain breeds that are prone to, well, especially copper storage diseases. So they store too much copper in their liver, and we have to try to get that out of the system so it doesn't cause toxicity. We do that by metal chelation therapy. So these drugs are used to chelate or bind excessive amounts of metals. We have D-penicillamine, and that forms a water-soluble complex with copper, which means that it can now be excreted and eliminated from the body through the urine. So there are some side effects again, anorexia, lethargy, vomiting. You might be seeing kind of a trend here. There's a lot of drugs that we give, especially oral drugs that cause anorexia, vomiting, diarrhea, and quite a few that cause lethargy as well. And of course, these are not in all cases, and they happen to varying degrees. And then we have zinc. Zinc actually prevents the absorption of copper in the intestine. And the one thing to be aware of with zinc is that it might inhibit iron absorption if you give too much of it. So you may be helping with the copper storage problem, but if you give too much zinc, then you're going to have a problem with iron, and then you're going to get an anemic animal. And we want to make sure we're helping these animals, so we have to be a little bit careful with zinc. The other liver condition that I just want to mention is hepatic encephalopathy. So the most common time that we see hepatic encephalopathy is with dogs, and usually we're looking at like Yorkies and little dogs who have portosystemic shunt, or otherwise known as a liver shunt, where there's a blood vessel that's actually bypassing the liver. So it's taking blood that's coming in from, say, the gastrointestinal tract. It's supposed to get filtered through the liver, but instead of going through the liver, this blood is going directly back into circulation. And by going directly back into circulation, it brings with it toxins, most notably ammonia. That ammonia affects the brain and causes neurological signs. So these signs include lethargy, dullness, ataxia, seizures. If we're looking at the classic kind of Yorkie, hepatic encephalopathy, these guys, maybe they've just eaten a meal and all of a sudden they start head pressing. So they're going up against the wall, pressing their head against the wall. And this is a very classic kind of hepatic encephalopathy sign. So how do we treat this? Well, ideally, we can actually ligate that portosystemic shunt. So we ligate that vessel so that blood can't pass through it anymore. Obviously, that's a surgical intervention, and it tends to be one that has to be done at a referral facility, so we don't always have access to that. So if we don't have access to it, or if it's going to be a little while before we can get that done, what we often do is we start these dogs on lactulose, and that will decrease the gastrointestinal transit time and the absorption of ammonia. So why does that happen? Lactulose is a laxative. So it speeds everything up, it kind of it gets things moving, and the intestine basically doesn't have enough time to absorb the ammonia. Another way we can decrease ammonia is by giving neomycin or metronidazole, so basically an antibiotic, and that decreases the number of ammonia-producing bacteria in the gut. And all of these things will help with decreasing transit time, decreasing the ammonia in the blood, and therefore decreasing neurological signs in these guys. As you can imagine, a side effect of these drugs would be diarrhea, because things are moving quickly. When things move quickly, we don't tend to have the nice solid bowel movements that we'd be used to. All right, so we're going to talk about cardiovascular disease. That involves structural damage or rhythm disturbances of the heart. So you guys probably covered all this in common diseases, so you'll be familiar with cardiovascular disease in general. So obviously we're going to focus here more on drugs and how we use drugs to treat cardiovascular disease. So the disease itself will result from damaged cardiac muscle. So cardiomyopathy. So that's basically disease of the heart muscle is what we're generally talking about when we talk about cardiovascular disease. There's also pericardial disease. So you guys remember what the pericardium is? Yep, that membrane around the heart. Rhythm abnormalities, so any kind of arrhythmias. I personally have an arrhythmia, so I'm very familiar with these. Or altered coronary circulation. Do you know what coronary circulation is? No? So the coronary arteries are the vessels that feed the heart muscle. So they're the ones that actually take blood to the heart muscle. So in humans, you always talk about people having heart attacks. We don't see that nearly so much in animals, but heart attacks are an interruption of blood flow through the coronary system to the heart itself. So it's basically a myocardial infarct, or MI. That's a heart attack. And that's caused by an interruption of blood flow to the heart muscle. So you get an infarction, you get loss of blood flow to an area of muscle, and you get death of that part of the muscle. So that's why heart attacks are really serious, obviously, because we need that muscle to work to stay alive. So cardiovascular disease can progress to clinical heart failure, and you've probably talked about that as well, but it results in accumulation of fluids in the tissues, which is also known as edema. So pulmonary edema or potentially edema in other parts of the body. How do we treat it? Well, first of all, we use diuretics because, like I just said, we get edema with heart disease when it gets into congestive heart failure or heart failure. So diuretics are used to mobilize that edema, mobilize the fluid, get it out of the tissues. This is obviously very important when we have an animal who has pulmonary edema. And there's fluid buildup in the lungs, and that's going to interfere with that animal's ability to breathe and to get oxygen into its bloodstream. So the goal of diuretics is to increase sodium and water excretion. The sodium goes out, the water follows. So furosemide is the one we use most commonly. It's also known as Lasix, so you might have heard of that before. It's the most potent and commonly prescribed diuretic in vet medicine. It's a loop diuretic. What that means is it blocks the key sodium transport mechanism in the loop of Henle. So you have in this little diagram here your loop of Henle, right there. Within it has a lot of different pumps that pump things kind of in and out of the urine. And one of the things that it does is it transports sodium back into the body so that you can preserve the sodium, and with it you preserve water in the body. So by blocking that pump, sodium goes into the urine and water is going to follow. So it's going to draw water out of the body that way. Does that make sense? Okay, that's how that does. That's how that works. And then we have hydrochlorothiazide. It's used only in cattle. So not used in small animal medicine, just so you know what it is. It is a diuretic used in cattle. There's spironolactone, which is sometimes used in small animal medicine. But by far and away, the one you're going to need to know about is furosemide. And so that's the one that we're going to focus on in terms of diuretics and using diuretics to treat heart disease. So a couple of things that owners need to be aware of when you're treating with a diuretic. You're going to see PUPD, right? So these animals, you're flushing all the water out of them, they're going to really feel a drive to drink. So that's very important. Owners need to know these animals are going to be PUPD. There's no way around that. Most owners don't care if you're saving their animal's life. So we need to monitor their electrolytes because they're going to lose electrolytes with all that water and obviously the sodium. And you're going to need to monitor their hydration always. So these we like to use as short term as possible to kind of get through the crisis and then kind of keep them around at as minimal a level as possible, or sometimes eliminate them altogether. Another group of drugs we use commonly to treat cardiovascular disease is our inotropic agents. And these are drugs that are used to improve the contractility of the heart muscle itself. So most of the time when we're dealing with heart failure, especially in dogs, heart failure in dogs tends to come in the form of more of a dilated cardiomyopathy. So we've got these like Dobermans and stuff coming in with water balloon hearts, and they're not able to pump very effectively. So what a positive inotropic drug does is it strengthens each beat of the heart. So it strengthens that muscle, it helps the heart to pump more efficiently. So that's what an inotrope is. So there's a couple of examples of ones that we might use in practice. Digoxin is like the original one, and it's a naturally derived drug that's used in patients in congestive heart failure primarily. It increases the calcium concentration in the cardiac muscle cells. So as you know, more calcium is going to lead to essentially an increased force of contraction. So we have to monitor this drug really, really closely. It has a low therapeutic index. So what that means is that it's very easy to overdose on this drug. So very, very careful with this drug. We have to monitor it closely. Because of that, it's not usually our first choice. Certain dogs respond quite well to digoxin, and we might reach for it, but I tend to try pymobendin first. But just so you know, digoxin, there are some toxic signs to always look out for with these guys. Usually they're gastrointestinal signs, but sometimes arrhythmias, which of course we don't want in an animal with heart disease at all. So very, very careful with that one. And then there's our pymobendin. So this is vetmedin, and this is what you're going to see more commonly. And I'll talk about kind of our triple cocktail of congestive heart failure treatment in a few minutes. But it is pymobendin or vetmedin is a positive inotrope and a balanced vasodilator. What that means is that it dilates the blood vessels, and in doing so, it helps to decrease blood pressure. It helps to decrease the afterload, so the force against which, or the pressure against which the heart has to beat. So it lets it eject more blood into the bloodstream. So it does this by inhibiting phosphodiesterase 3. And again, that increases the intracellular concentration of calcium. So that results in a stronger beat. This is obviously, it's used in the treatment of congestive heart failure in dogs and is generally well tolerated. So I don't see a whole lot of side effects, but if you're going to see side effects, it has to do primarily with either vasodilation, so low blood pressure, gastrointestinal upset. Now that's just something that can happen with pretty much any drug, and then nervousness. Nervousness, I don't know what causes that. I haven't seen it so far, so I've been lucky. But just to know that that could potentially happen. Antihypertensives. So these are drugs that lower blood pressure. The big ones that we're going to talk about are the ACE inhibitors, enalapril and benazepril being the ones that are most commonly seen. When I first started practicing, I tended to use more enalapril. Now I've kind of switched over and use benazepril, which I would say most vets now use. So benazepril, also known as Forticor. So these function as vasodilators by inhibiting ACE, which is angiotensin converting enzyme. And there's that fancy little diagram over there that's going to show you how that works. I'm not interested in you getting all caught up in that unless that helps you to understand and learn how it works. But there's a very kind of complicated mechanism whereby these exert their effect. But the bottom line is that these are vasodilators. They cause relaxation in the blood vessel walls, they cause vasodilation, and you get that decreased blood pressure. And again, same thing as with the balanced vasodilation that comes with vetmedin, you suddenly have a decreased afterload, decreased pressure against which that heart has to beat. And that's what this is primarily used for. It's used in kidney disease and heart disease. In kidney disease, the vasodilation just allows more blood flow through the glomeruli, and so allows more blood to be filtered through the kidneys more easily, basically. So that's when it kind of gets used there. But I would say more often than not, if I'm using Forticor, it's a heart failure animal. You have also amlodipine. So that's a calcium channel blocker that's an antihypertensive. It treats plain old hypertension, whether it's heart related or not. There are many different reasons that we can get hypertension. So we use amlodipine if we have an animal that has chronically elevated blood pressures. The most common time when I use amlodipine is with these hyperthyroid cats who are crazy hypertensive all the time, and just the medication alone isn't keeping their blood pressure under control. These guys I'll often put on amlodipine. Sometimes instead of Forticor, we might use it in kidney failure cats. Kidney failure animals just in general tend to have high blood pressure, so we do need to give them something a lot of the time to decrease that blood pressure. So side effects of any of these hypertensives are going to be hypotension. So that only makes sense, right? So we have to be careful of how much we're giving, make sure we're giving it properly, giving it at the right time, and the right doses, and usually they work really well for us. And this is our triple cocktail of congestive heart failure drugs. So you have your dog that comes in with, dyspnea. This is how these guys almost always present. They come in respiratory distress or just dyspneic and not right. And then you have a listen and you think you hear a heart murmur, you hear crackles in the lungs. Chances are if we do a workup, this is an animal with heart disease. If it's especially if it's like a little older dog. So if we diagnose our congestive heart failure patient, then we have to get them on treatment. So because we're not going to be going in and doing open heart surgery on these guys, we are stuck with medical treatment. So this is our triple cocktail. Any animal that I see with congestive heart failure, after we treat in hospital and get them stabilized, they kind of go home on this. When we treat them in hospital, by the way, we're stabilizing them, again, by trying to get that edema out of the system. So trying to clear out the fluids. And we do that with furosemide. So that's what we use in clinic until we get them to a point where they seem to be comfortable, they're breathing well on their own, and we can just keep them going at home on the triple cocktail. So here's our Forticor. They come in these nice flavor tabs. So that's, remember, our vasodilator, our ACE inhibitor. It's going to fight off hypertension. It's going to decrease afterload of the heart. So again, the heart is not beating against a lot of pressure. So that's what Floricor does. Vetmedin, that's our positive inotrope. Vetmedin is going to increase the contractility of the heart, strengthen each heartbeat, and force more blood into the circulation. And then, of course, our furosemide, which is going to kind of dry things out, make it so that the animal can breathe again. Depending where the heart failure is, it might not be that we're looking to get the fluid out of the lungs. Maybe we're trying to get it out of the abdomen. Furosemide does not work as well for that. We often have to actually physically go in with a needle and take all that fluid out, draw it out. That's abdominocentesis. So that's sometimes what has to happen if we have an animal with right-sided heart failure. An animal with right-sided heart failure is going to get blood backing up into the rest of the system because the blood is not getting back into the heart as well as it should. So you get increased kind of pressures in the, abdominal vessels, and you get leakage into the abdomen. So that happens as well. It's a different type of congestive heart failure, and it's not the one that we use the triple cocktail for most of the time. At least it's not the one that we use for furosemide for. It's not effective for ascites. All right, so triple cocktail. Any questions on our triple cocktail for congestive heart failure? So just a note, this drug combination either works really, really great or not at all, is what I find. So it takes, a couple of weeks to kind of get an animal onto this, get them started to start to regulate them, and then what happens is they either do okay and really keep improving during that time, and then do quite well for several months or a year or something like that, or they die within the first week or two. There's kind of not a lot in between. So if we can get them onto this, then they tend to do well for a little while. But we can't fix the heart, so we're just trying to help them out in the meantime. All right, there's some other antihypertensives I'm just going to mention so that you've heard of them. Hydralazine is an arterial dilator, so most of the time we have vasodilators. There are arterial dilators. So that's the hydralazine. It works directly on the smooth muscle that lines the arteries. There are side effects. We don't use it a lot. In fact, I've never used it, so I can't comment more than that. But it's out there, so your vet may need that in certain cases. There's sildenafil, which is Viagra. So it can be used. It is a vasodilator. That's what it's for. That's what it was designed for. It just turns out it had other effects, which they took advantage of. It can be used for hypertension, pulmonary hypertension specifically in dogs. So if your vet is, prescribing Viagra for a dog, it may not be for the reason that we all think of. Antiarrhythmics. So obviously these are drugs that are used to control heart rhythms and to treat arrhythmias. These aren't used all that commonly. There are only, rare cases where we really need them. But there's a couple of classes of antiarrhythmics. There's class 1. So examples of class 1 antiarrhythmics, lidocaine. We've heard of lidocaine before, right, as a local anesthetic. Well, it turns out it's a wonderful antiarrhythmic as well, so bonus. Quinidine is another example. So these block fast sodium channels, and that stabilizes membranes, slows conduction and velocity of the action potential. So it's basically trying to control the conduction of the electrical signal through the heart. And by helping to control that, it kind of calms down all that kind of hyperactivity that can happen and cause arrhythmias. And then we have our class 2. These ones are used more commonly as antiarrhythmics, among other things. These are beta blockers. You've probably heard of beta blockers before. Yeah. We use these a lot in cats. So they're technically beta adrenergic blocking agents. Again, they're going to be called beta blockers. They decrease the sympathetic input to the heart. What's the sympathetic input? What's the sympathetic system? Fight or flight. So your sympathetic nervous system is going to want to throw things in overdrive all the time. It's going to want you to be kind of panicking a lot, right? which can cause arrhythmias. So we decrease that sympathetic input to the heart, and that kind of slows things down and calms things down, and that's what beta blockers do. A couple of examples: propranolol and atenolol. Anything ending in all is going to be a beta blocker. Atenolol I use a lot in cats to slow the progression of hypertrophic cardiomyopathy. HCM is, I don't know, I had a cat with HCM, and he ended up dying when he was 5 years old. But we diagnosed him when he was 1 or 2 and had him on atenolol for those years in between, which I'm sure gave him extra time, because HCM is a really nasty heart disease. It can kill cats very young. They get the saddle thrombus, right? And then they pass away usually as a result of that. So that's what happened to him. But in the meantime, we got some extra time out of him by giving him atenolol. So basically, I always think of this as, the heart, especially a diseased heart, I mean all hearts, but especially a diseased heart, has only a certain number of beats that it can beat before the animal will die, essentially. So what we're trying to do is slow down that heart rate in order to make those beats last longer. Does that make sense? So if we only have, X number of beats before that heart gets so big it's not going to work properly, well, let's try to slow them down and make those beats kind of last over a longer period of time. And that's what our beta blockers do for us. Oh, yes, there's class 3 and class 4. These ones, I'm trying to think. Oh, yes, we sometimes use class 4. So class 3, sotalol can be used to treat ventricular arrhythmias. Basically, these would be used potentially in boxers that have that boxer cardiomyopathy thing. So that's when we might use sotalol. And then class 4 is calcium channel blockers. So diltiazem being the one that you'll see in veterinary pharmacies. They slow conduction through the AV junction, or the AV node, and effectively that slows the ventricular rate. And again, these are used in HCM cats primarily. They can also be used for supraventricular tachycardias. Do you understand that term? So basically the atria are fibrillating, so the atria are not contracting normally or contracting too quickly. Sometimes there's a bit of a disconnect between the atria and the ventricles. So the atria are kind of going crazy up here and not really functioning very well. But the ventricles still work okay, so animals tend to do all right. My brother has atrial fibrillation, and he does most of the time. He does pretty well, but diltiazem can help with that. An animal, are you guys aware of an animal that gets a lot of atrial fibrillation? Horses, of course. Horses like to go into AFib. Did Bianca show you a video of a horse getting cardioverted? What's that? Oh, no, that was horse ECG, yeah. So horses get atrial fibrillation, so their atria are kind of going like this, like fluttering, and then the ventricles every once in a while are kind of like, I guess I better do something, right? So they tend to do okay as long as they're not racing, but horses, a lot of the time, to get them out of atrial fibrillation, you can use drugs. So you can use something like this. Sometimes that works. A lot of horses now go for something called cardioversion. Yeah. So my horse prof at OBC actually designed a way to do this in horses. So we had horses coming from all over the continent to have this procedure done. So basically we anesthetize them, give them a big electric shock. They kind of fly off the mat a little bit. And we shock them back into normal rhythms. So it's quite impressive to actually witness. But it works really well. A lot of times these animals stay in normal rhythm afterwards. Sometimes they come back for a second go. We had one when I was there that the guy came up from Texas to have this done to his horse, and then it was like the second or third time he'd been there. So it does happen. They do relapse. Yeah, atrial fibrillation. Good times. Here's a case study on cardiovascular drugs. So we have a 14-year-old female spayed Cocker Spaniel, brought into the clinic because the owner thinks she's not really as energetic as she used to be. So she's up to date on her vaccines. She's been heartworm tested annually. The vet notices her mucous membrane color is not really as pink as it should be. There's a heart murmur when she has to listen to the heart, and there's some fluid potentially in the abdominal cavity in this case. So these signs would point me, and probably you guys shortly, to potential heart disease. And the appropriate diagnostic tests are done. So chest rads, very common diagnostic tool that we use because you can do it at any clinic. They showed an enlarged heart. The ECG looks normal. Her blood values are normal. The dog's diagnosed with congestive heart failure. And the vet prescribes a diuretic and a mixed vasodilator. So the vet also prescribes a sodium-restricted diet without any treats. Aw, poor doggy. So now the owner asks how all these drugs are going to help her dog. What should the veterinary technician tell her? So you guys are often responsible for discharging these patients because they've often been in clinic for a couple of days, or even just for the day, and you're going to be telling the owner about these drugs and how they work. So that's why it's really important that you know and you can tell them. So how are these drugs going to help her dog? Why does she have to change the diet, essentially? Why a low sodium diet? How is the success or failure of cardiac treatment assessed? How do we figure out if it's working? And when should the owner bring the dog in for recheck? So these are all common things you'll be discussing with owners. So first of all, how are these drugs going to help her dog? Well, the dog has been prescribed diuretics and vasodilators, right? So diuretics, what do? They take the fluid out of the body. They decrease preload. Do you remember preload and afterload? Are these foreign concepts to you? Preload is the amount of blood returning to the heart. So that's basically how much fluid and how much blood is in the blood vessels returning to the heart. That's preload. So by taking the excess fluid out of the body, we reduce the amount of blood trying to get through the heart to begin with. So we reduce preload. So since the heart has less fluid to move, it doesn't have to work so hard. So that's one of the things that it does. Vasodilators, I've mentioned this a few times, decrease afterload. So they decrease the pressure against which the heart has to pump, so the resistance to blood flow. So the heart doesn't have to overcome that resistance so much to allow the movement of blood. So again, it doesn't have to work so hard. So our whole goal here is to prevent the heart from having to work hard, because it just can't, frankly. So question 2, why can't she keep her dog on the same food she's been feeding for so many years? What's the rationale behind low sodium diets for animals with CHF or congestive heart failure? So just like we talked about on the last slide in question 1, we want to decrease the preload, and sodium-restricted diet also decreases preload. Why? Well, remember that where sodium goes, water follows. So if we decrease the sodium in the diet, then the volume of water in the blood decreases, meaning that the volume of blood decreases. So the heart does not have to move as much blood, decreased preload, and there we go. We have decreased strain on the heart again. Okay, question 3. How is the success or failure of cardiac treatment assessed? Is there any way to determine if the drugs and diet restriction are working? Well, and I would hope so, right? So there are 2 ways of determining if things are working. First is by clinical assessment. This is probably the most important thing. So we look at the animal. Hopefully we see decreased fluid in the abdomen, decreased coughing, increased energy levels, that sort of thing. A huge part of this is talking to the owners and saying, how is your dog doing at home? And if the energy is better, the dog's eating well, just seeming more like him or herself, then we know we're on the right track. Then we have diagnostic tests, so things like chest rads, blood tests, ECG, those kinds of things can all really, really help us in determining whether our treatment is working. So we use them, and it's always, always wise to recheck animals that are diagnosed with any kind of cardiovascular disease. Because, we want to catch any deterioration early, and if we're on the right track, we need to know, do we need to decrease maybe the diuretic use or whatever? We need to make sure that we keep monitoring and making sure that dog continues to improve. Okay, when should the owner bring the dog in again for re-examination? Well, pretty much right away. If we're not seeing an improvement very quickly, then that dog needs to be seen very, very soon after discharge. And the reason for that is that we should really see a lot of improvement very quickly in these guys because the diuretics should be getting that fluid out. And once the fluid gets out, we should see a decrease in the cough, we should see a decrease in any ascites or anything like that. So if that's not happening, we need to recheck that animal very quickly. If we're starting to see some improvement, then it kind of depends on how the animal's looking overall and the veterinarian's assessment and recommendation. So in a non-emergency, then probably 1 week or so after the initial diagnosis and the start of treatment, then we'll probably get that animal back in for a recheck. Okay, here we are moving on to neurologic disease. So neurologic diseases in veterinary medicine are probably some of the most frustrating to deal with, at least if you ask me. And that's largely because it's difficult to diagnose these without the fancy equipment, so our MRIs and CT scanners and stuff, which most general practices don't have access to. If you happen to be lucky enough to work in a referral facility, you might have access to these, and that way you have a lot more options in terms of targeted treatment and surgery and that sort of thing. But let's just talk about general practice and how we tend to deal with these. So we usually treat most neurological diseases by trying to control signs and symptoms. So if we're talking about a brain injury or epilepsy or that sort of thing, we just want to control seizure activity, and we do that with anticonvulsants. Phenobarbital is the most common anticonvulsant used in veterinary medicine. It's our first line. It's cheap, it's readily available, and that's why we use it. Well, also it works really quite well, so that's why we use it most commonly. There are some known drug interactions with phenobarb. It increases the activity of cytochrome P450, if you remember that from earlier on in pharmacology. So what that does is it induces metabolism of drugs. So if you're giving other drugs concurrently, you might have to increase their dose or really monitor the effect of those drugs a little more closely. Then there's potassium bromide, which is a salt, actually, which has anti-seizure effects. It's not recommended in cats, but we do use it in dogs along with phenobarbital, and we do that really to decrease the amount of phenobarb that we have to actually use. So if we decrease the dose of phenobarb, then we decrease the associated liver effects, among other things. So we put phenobarb and potassium bromide together. They work synergistically, which means that the two of them together work better than either one alone. They kind of augment each other's activity. So phenobarb plus potassium bromide is a really great combination in most dogs. However, if we get into these cases that develop liver disease and ongoing health issues because of long-term phenobarb treatment, then sometimes we have to look at another anti-seizure medication. And Levetiracetam, or Keppra, is one that's used more and more commonly. So it tends to be used if phenobarb is not working, so if it's not having as good of an effect as it should, or if it's contraindicated, meaning the animal already has liver issues or has been on it long term and is having issues. So that's when we tend to use it. It's more expensive, but it does have fewer side effects. Okay, so we'll go into these drugs in a bit more detail now. The first one being phenobarbital. Remember, our go-to drug for seizures. It is a controlled drug. So anytime you dispense this drug, anytime you use it injectably, you must record it in the narcotics log. Do not forget that, or you could get in some trouble. It can cause hepatotoxicity, so it is hard on the liver, as I already mentioned, and that hepatotoxicity can be reversed if we catch it early enough. So monitor, monitor, monitor. Always check these guys for any changes in liver values, among other things. But just these guys need to be monitored closely. It lowers thyroid hormone levels, so T4 will go down with phenobarb administration. So just bear that in mind. So if the doctor's looking for hypothyroidism for some reason in this dog, it might be worthwhile to remind the doctor that this dog's on phenobarb and that can interfere with T4 levels. So always important to check other parameters as well, like TSH, maybe even T3, when we're looking to diagnose hypothyroidism. Excuse me. So drug interactions. Remember that Phenobarbital induces activity of the cytochrome P450 enzyme in the liver. So that is going to increase or speed up metabolism of certain drugs. The ones that we know about for sure, digoxin, so that's a heart medication often used for arrhythmias in dogs, or not often, but that's what it's used for. Glucocorticoids, so steroids. Well, we know steroids and phenobarb are closely related, so we don't want to use them together. They have the similar side effects, as you'll see, that kind of thing. Certain anesthetics are going to be altered. Their activity will be altered by phenobarb. So very important to remind the doctor before anesthesia that this dog is on phenobarb. Side effects of phenobarb, so sedation. This is the number one side effect, absolutely. So if you have a dog that you're starting on phenobarb, you can expect to see some pretty significant sedation, at least for the first little while. And in fact, sometimes we can even use phenobarb as a sedative in animals that are very highly anxious. So sedation, number one. And ataxia, you can see in rare cases. It's not common. But PUPD, absolutely, you can see that. Polyphagia, those sound very similar to steroids, so that's because they are. So PUPD, polyphagia, and weight gain, very common with phenobarb. Potassium bromide is the salt that I mentioned earlier that is often used in conjunction with phenobarb so that they can have a synergistic effect. They work together to be more effective than either one is alone. So it can have a generalized depressant effect on neuronal excitability and activity. That's kind of how it does its thing. So be aware that it is a depressant. It's compounded. So this drug is no longer used in the human world. When we order it for animals, we have to order it through a compounding pharmacy like Summit or Chiron, and then we can get it, made up at whatever dose we need. So it's compounded and sent to us that way. It can cause pancreatitis when it's used in conjunction with phenobarbital. So again, this is another one to be careful with when an animal's already on phenobarb. I haven't personally seen this, but I know it's possible. So just be aware if there are any gastrointestinal signs. Bring that to the vet's attention. This dog's on phenobarb. This dog's on potassium bromide. Maybe let's check the pancreas. So cats. Do we use potassium bromide in cats? The answer is no, no, no. It can have very severe pulmonary effects. We avoid it in cats. In cats, we will use phenobarb, but we will not use potassium bromide. Levetiracetam, or Keppra, I mentioned as being kind of a newer anticonvulsant that we do use in certain cases. And again, it's used if we can't get the combination of phenobarb and potassium bromide to work, or, in a cat, we can't use potassium bromide. So if phenobarb's not working, or if they're having serious side effects to one or both of those medications, or their liver is failing, those sorts of things, then we might look at, well, what are our options here? So levetiracetam kind of being our next one that we go to. It's well tolerated in both dogs and cats. There's some transient side effects, so warn owners about these, but tell them just to wait it out, and they should just go away on their own. Again, sedation in dogs. Anorexia and lethargy in cats. I know a lot of people who can't tell if their cat's lethargic. That would be my cats as well. But anyway, so lethargy and anorexia, watch out for that in cats. But again, those should resolve. Make sure your cat is eating something for a few days, and then hopefully he or she will get over that. There are more side effects to Keppra when it's used together with phenobarbital. So we don't usually combine those two. That would be a pretty severe case of intractable seizure activity if we were thinking of doing that. There is some evidence, unfortunately, that the effect of levetiracetam might wane over time. So again, these animals need to be in routinely. Even if they're doing really well, maybe every 2 or 3 months, check in, see how the seizures are going, see how the side effects are. We want to make sure to catch it early if Keppra is starting to have decreased activity. We're going to move on now to behavioral pharmacology. So in a lot of ways, related to what we were just talking about with other nervous system drugs. But these are drugs that we use for specific behavior problems when training alone isn't working, or if a dog is in such a state that they can't be trained. Say they're too anxious or too fearful or aggressive or something like that. So some of the common behavior problems are listed here: separation anxiety, fears, phobias, unruliness, I know several of those, hyperactivity, compulsive disorders, cognitive dysfunction, inappropriate elimination, big one in cats. I'm personally dealing with that issue right now with one of mine, who is now on kitty Prozac. Benzodiazepines are kind of our go-to anti-anxiety drugs, and I'd say they're probably the go-to anti-anxiety drugs in humans as well. The way that they work is that they bind with and promote GABA activity in the cerebral cortex in the subcortical areas. You don't need to really worry too much about that. What you need to know is they stimulate GABA receptors, and that promotes relaxation. So one thing that we're going to talk about a lot when we're talking about anesthesia is muscle relaxation. And diazepam, Valium, that is the drug that we use most commonly in anesthesia for muscle relaxation, but it can be used as an anti-anxiety drug in kind of day-to-day life for certain animals. So diazepam, probably our most commonly used one, also known as Valium. It can cause liver toxicity in cats. This is rare, but it can be quite dramatic. So very careful using this in cats. They just need to be monitored again. Usually it is reversible if it's caught early. If we give Valium or diazepam IM, it can be irritating. We try to avoid it. It can sting, it can cause tissue damage, so we don't tend to give diazepam IM if we can avoid it. We will go to midazolam if we need something to go IM. Midazolam, we're starting to use more and more commonly anyways in pre-meds and things like that. It's a really nice, relaxing drug and just causes the whole anesthetic experience to be better. In fact, my son has had several surgical procedures, and recently they've started adding midazolam before before induction as a pre-med, and he has done much, much better with the whole thing. So I kind of like midaz. Alprazolam, this is a really, really useful drug. It is good for things like thunderstorm phobias or other episodic anxiety-provoking events. So think about fireworks, those loud, startling noises that a lot of dogs and some cats as well find extremely terrifying. So if we have animals with thunder phobias and that sort of thing, and maybe we've tried the thunder shirt and the calming pheromones and all that stuff and it's not working, alprazolam is a nice next step to go to. So also known as Xanax in the human world, we can use this just on an as-needed basis. So if, say, it's Canada Day and we know there's going to be fireworks at 10 o'clock, well, why don't you pop one of these into your dog at 9, and then he's going to be nice and relaxed and not worry so much about the fireworks. Same goes for if we know there's a thunderstorm coming. So this can really, really be helpful. I also use it for travel in certain cases. If some animals are really anxious about travel, alprazolam and all the benzodiazepines really are quite safe. They're safe cardiovascularly. I don't worry about blood pressure so much with them as maybe with some other things like acepromazine and other tranquilizers we've used for travel. So alprazolam, really great drug. It can be used once in a while as needed, so I really like it for that. Lorazepam, also known as Ativan. This is not commonly used in vet medicine. It's there, it's available. I haven't used it yet. It's used in people obviously a lot more. So those diazepam, alprazolam, midazolam, lorazepam, you'll notice that they sound quite similar, and those are all benzodiazepines. So again, safe drugs. They do have some side effects. We can see some lethargy, obviously, ataxia, and generally fairly dose dependent. PUPD, very common side effect with a lot of drugs. I don't see it too much with these guys. And then hyperexcitability. That is a paradoxical effect that can happen in certain species, especially cats and horses, unfortunately. We really need to be careful that we dose it properly, and most of the time we can avoid hyperexcitability, but it is unpredictable. So we can't guarantee that any one patient won't experience hyperexcitability. So let's just hope that most of them don't, and most of them don't. On to tricyclic antidepressants. These drugs actually exert their effect by preventing the reuptake of norepinephrine and serotonin in the brain. So you may know that serotonin is kind of known as the happiness molecule. So it tends to promote feelings of well-being and that sort of thing. So the longer it has to exert its effect before it's removed from its site of action, the more happy, kind of uplifting mood you're going to see in your patients. So that's what serotonin does. And now, of course, norepinephrine is related to the sympathetic nervous system and is kind of like an adrenaline type thing. So that kind of stimulates being more awake, I guess. It increases maybe your level of consciousness, and serotonin makes you feel happier, and that's how tricyclics work. So these are used for separation anxiety, obsessive disorders, and yes, animals get those. Fear, aggression, urine marking, hyperactivity, hypervocalization, a lot of those really annoying behaviors that we see in our pets. Side effects, you're going to notice that a lot of times these side effects are quite consistent over a lot of these drugs, sedation being number one always. In this case, because of the norepinephrine component, we might see tachycardia, right? Because sympathetic nervous system increases heart rate. So tachycardia, we can see heart block in certain cases, so our electrical signals may not make it through the electrical conduction system of the heart as effectively as usual, so it's possible to see heart block with these guys, although I would say uncommon. And urine retention, again, not too terribly common, but we have to watch out for that. Some examples of these antidepressants: amitriptyline used to be kind of our go-to drug for urine marking, inappropriate urination in cats, along with some other common anxiety-related disorders. I think we're getting a little bit away from it, but we do still use it quite frequently. And then clomipramine, also known as Clomicalm, which you've probably seen if you've spent any time in a clinic. So Clomicalm, often a go-to drug, especially for dogs. SSRIs are also known as selective serotonin reuptake inhibitors. You've probably heard of these in human medicine. So again, these slow the reuptake of serotonin in the brain. And again, that allows the serotonin more time to exert its mood-boosting effects. And these drugs in animals are used for obsessive disorders, again, phobias, aggression, and separation anxiety. So some side effects that we're going to see with these occasionally: anorexia, nausea, lethargy, of course, anxiety, and diarrhea. These are, again, usually transient with these drugs. So if we can persist a little bit through some of these, then there's a good chance that the animal will be okay after a little while. These are used off-label in vet medicine, but there's a lot of research that's gone into, how they can be effectively used, and we do so pretty frequently, actually. So examples of these would be paroxetine, also known as Paxil. This I've used on occasion in highly, highly anxious dogs in combination with other drugs. So these are the dogs that can't be managed by kind of our traditional anti-anxiety medications like Clomicalm or amitriptyline or anything like that. If we cannot manage those with just maybe some benzos and tricyclics, then we might go to paroxetine. So then we have fluoxetine, also known as Prozac. That is what I'm currently using for my cat who's peeing around my house. So it's useful for inappropriate elimination in cats primarily. That's usually where we see it most often used. So kitty Prozac. And then we've got sertraline, also known as Zoloft, used more commonly in human medicine, of course, but certain practitioners will use that in animals. Then we have our monoamine oxidase-B inhibitors. This is technically another class of antidepressants, but we can also use this to treat old dog dementia. Also, hyperadrenocorticism, so Cushing's disease, can be used. We can use anapril, at least allegedly. We can use that to treat HAC. So interesting group of drugs. So side effects of these, again, vomiting, diarrhea, anorexia. Those are always side effects of oral drugs. Then we have restlessness, lethargy, of course, salivation, shaking, deafness. So you can see for these ones, we do have kind of a broader spectrum of side effects. So that might make us hesitate a little bit to use these, except in certain situations. And that, again, for me, would be the dementia type situation. And in certain cases, Cushing's disease, although we don't use Anapril nearly so much anymore for Cushing's. So if you have any questions about anything we've covered here so far, please don't hesitate to email me or any of the other vet tech instructors, and we're happy to help you out. Okay, so neoplastic disease, which is obviously cancer. Like I said, you're not going to see a lot of it in general practice, but from time to time you will deal with these cases. I mean, you'll deal with cancer all the time, but sometimes you will deal with chemotherapy. You won't likely deal with radiation therapy unless, again, you're in a referral hospital. But just know that it does exist and that it is available to animals in certain cases. So chemo drugs. So the most important thing to know about chemo drugs is that they're dangerous. They're cytotoxic. They kill cells. They kill rapidly dividing cells. And that's how they work. So we have to be really careful when we're handling them. So they're subdivided into different groups. Their job is to target tumor cells. And again, that's why they target rapidly dividing cells. They do have significant side effects. Again, they're cytotoxic, require special handling. And careful IV catheter placement in these guys is critical. You don't want these drugs going perivascular if they're supposed to go IV. So very, very important to make sure you have a great, well-placed, patent IV catheter. So just quickly, I'm going to touch on some of these. I'll try to highlight what's important here. So here's some common chemo drugs. And I'm just going to talk about their side effects because, again, these are the more important things to know about. So cyclophosphamide can give you bone marrow suppression, as most of these things can, because what's rapidly dividing? Well, bone marrow all the time. So bone marrow suppression and hematuria, you see with cyclophosphamide. Vincristine, it does cause tissue necrosis if given extravascularly, which I just mentioned. Really careful with your IV catheter placement. And again, low white blood cell count, that has to do with decreased activity in the bone marrow. Doxorubicin, it has a lot of side effects. It's nasty, but it works really well, so we do use it. So it does also have gastrointestinal issues with this one and hypersensitivity. So animals can be allergic to this. We do recommend giving Benadryl essentially about a half hour before we give this drug to pretty much any animal, just because the incidence of hypersensitivity is quite high. Prednisone, we all know about prednisone. We all know about prednisone's side effects: polyphagia, PUPD, panting, and you can also in some cases get vomiting, diarrhea, and weight gain. And then L-asparginase, again, can cause anaphylaxis. So this is usually given sub-Q or IM rather than IV because it's less likely to cause anaphylaxis that way. And this is another one we might give Benadryl beforehand. Just to give you an idea of chemotherapy protocols, and I'm not going to ask you questions on this. You don't have to, spit this one out for me at any point. Lymphoma. So again, lymphoma is the one that we treat most commonly with chemotherapy because we have the best success with it. So for instance, this shows you on the different weeks which drugs they're going to be getting. So it's not the same drugs each time. It goes through a cycle, and we use usually somewhere between 3 and 5 different drugs at once in kind of a rotating fashion to treat these. You'll also notice that they're dosed per meter squared. So it's not mg per kg, it's usually milligrams or units per meter squared. And that's how chemotherapy drugs are always dosed. So just for ease of calculation, there are charts that do a rough conversion for you from kilograms to meters squared. So I usually just use those. All right, so basically, what I want you to get out of this is that we're using multiple drugs on a cyclical kind of basis. It's not just the same drugs every week for eternity. And and that they're dosed per meter squared. So that's what I'd like you to kind of get out of that. All right, so we have a client's boxer who's been diagnosed with lymphosarcoma, which is, of course, the same thing as lymphoma. It's the technical name for it. The owner and the dog are sent to a referral clinic for a complete workup and a discussion of its treatment options. The client calls his pet's primary clinic. After that visit with the oncologist, and that owner was offered a treatment plan consisting of 2 antineoplastic agents. The owner would like to have the treatment given at his pet's primary clinic so that he will not have to drive 100 miles to the referral clinic. The oncologist is willing to prescribe the meds and let the client have the treatments done at the primary clinic. So this is not an uncommon scenario. There are certainly many animals who do go visit an internal medicine specialist or an oncologist, and they come back kind of with a treatment plan, and we just do it. So this is where you need to know, how are antineoplastics handled? How are they administered in clinic and at home, because certain components of chemotherapy are done at home? And what should the client be told about safety precautions to take at home after chemotherapy treatment? And I will go through all these because these are not obvious answers for you. So we'll start by talking about how we handle them. So the risk of exposure to these drugs is greatest during their preparation and administration. So that makes sense because that's when you're handling the drugs. So inhalation of aerosols can be an issue. Direct contact and ingestion of spilled or improperly handled drugs. So most of the time you're going to be more careful than sticking your fingers in chemotherapy drugs and then licking them. But it is possible. Or if there's a spill and your mouth happens to be open, things can happen. Also, be careful of contaminated waste and excreta. So when animals are peeing and pooing after chemotherapy, those excretions are full of chemotherapy drugs. So you need to be aware of that, and owners need to be aware of that. So use latex gloves to protect the skin. So ideally double glove. Good hand washing before and after, and of course especially after handling the drugs. Prevent contact of antineoplastic agents with the skin or mucous membranes. If it does occur, lots and lots of water. So rinse. And soap is less important. You just got to dilute it, right? Dilute it out as much as you can. Document it. Seek medical assistance. Before the drug is prepared, put on a disposable surgical gown. A lot of clinics have these just available for things like isolation and animals that you really need to work at preventing spread of infection, right? So that they're around. So put one on. Goggles, eye shields, face shields. All these are good because you never know when you're going to splash something and maybe it's going to come back and get you in the eyes. So be careful about these. If you're reconstituting a drug, vent the vial at the beginning of the procedure. Do you know what that means? So you know how injectable drugs come in vials and you can stick needles in and draw them out and whatever. If you just take a needle and just stick it in, it releases the pressure. That's venting. So just sticking a needle in and letting it kind of equilibrate to the same pressure as the room. That's venting. And so that'll actually reduce the risk of spilling or spraying the solution when the needle is withdrawn from the vial. So once you take the needle out, if you have it attached to a syringe, everything kind of spits out. So if you vent it first, that won't happen. Use Luralock syringes. So Luralock syringes screw onto the needle so they're not going to come apart and have drugs fly in all directions. And again, that's going to help prevent spillage. Pregnant workers should always avoid the exposure to these. Very, very dangerous to the fetus. So pregnant people, stay away from chemotherapy drugs. How are these handled? So after careful preparation, most are given IV through an indwelling catheter, which is why you've placed your catheter very carefully in this case. And very important to educate the client. Huge. So discuss this with owners before the animal's discharge. It's important to point out potential hazards that are associated with human exposure, but don't scare them. You know, these are not that dangerous. As long as you know how to handle them, it's fine. You're going to be fine. When you're sending them home, they always have to be really clearly identified. So the vials, syringes, bags, everything has to be clearly identified with the labels that say chemotherapy on them. And the label also has to have clear directions for use, and unlike, you know, a lot of our other drugs, we put disposal instructions on there. So these are also always dispensed in a child-resistant container, which makes sense. And follow up with clients to make sure that they understand what you've told them and that they're doing it correctly. Don't ask, so are you wearing 2 pairs of gloves when you're handling this or whatever. You don't ask that. Instead, what you say is, so can you just show me how you give this to your dog or whatever. That way, you know if they're being compliant. What does the client need to be told about take-home medication? So again, these drugs are typically eliminated in the urine and feces. Usually about 24 hours post-treatment. You have to be really careful handling both of those. Also vomitus, that sort of stuff. Anything that's coming out of the animal could potentially have these drugs in it. So always, always, always wear gloves during this time period when you're cleaning up poo, or if there's a pee accident, or if the dog's vomited, or whatever. Always wear gloves. Some drugs are metabolized and eliminated more slowly. So if clients want to really be safe about it, the best thing to do is, for about 3 days, be really, really careful with handling anything coming out of the animal. Labeling of the medication should include a specified time period for handling of animal waste, and that's just telling the client, this is how many hours I want you to be very careful and wear gloves and everything after we give this. And they need to be given written educational materials. Clients forget about 80% of what you tell them in the exam room by the time they get home. So when there are really important points that owners need to take home with them, always, always give that in written form. And that goes for anything that you're talking to clients about. If there's something really important they need to remember, write it down. Otherwise, there's a very, very good chance that they're going to forget. Questions and answers should be reviewed with a client face-to-face, either by the veterinarian or pharmacist, or there are veterinary pharmacists out there who are awesome, but few and far between, and we don't have them around here. So very important that conversation happens. So as a technician, it's not your role to necessarily have that particular discussion that goes into the specifics of these drugs, but it's your role to make sure that it happens. So you need to grab the vet, put the vet in the room with the client and say, talk. Sometimes that's what you guys need to do. So really important for that client to leave with a clear understanding of the hazards and precautions of these drugs. All right, so here we are at parasitic disease. So just a reminder, you guys should be familiar. There are 3 classes of endoparasites. Endoparasites, parasites living within the body. Nematodes, which are roundworms. I shouldn't say they're roundworms. We call them roundworms colloquially. But yeah, the nematodes are a specific type. There's cestodes, which are tapeworms, and trematodes, which are flukes. Trematodes being the ones we see the least commonly in companion animals. They're more common in livestock. Ectoparasites, we have insects, flies, lice, and fleas. There's this good old Tinocephalides felis right there. It's a beautiful picture. Ascarines, so that's your ticks and mites. So that's your 2 types of ectoparasites. So there are several types of antiparasitic drugs. Macrocyclic lactones are kind of like what I would consider the original ones. These are like ivermectins and milbemycins. So ivermectin to me is kind of the original dewormer. It's used all the time still in large animal medicine, less so in small, with a few exceptions. These are broad spectrum. They're effective against nematodes. Remember, those are our roundworms. And arthropods. Arthropods, insects, those are fleas and that sort of thing. Don't use them in collies and related breeds. Remember why? It says right there. It's cheating. They're sensitive to ivermectin because the blood-brain barrier doesn't work properly. The P-glycoprotein mutation that normally would pump all that stuff, like ivermectin, out of the brain doesn't work. So that increases the risk of central nervous system toxicity, which could be quite deadly if enough was given and enough got into the brain. So avoid use in collies. We can do that. We have alternatives. They're highly lipophilic drugs, these macrocyclic lactones, remember? So that allows for wide tissue distribution. Remember, lipophilic drugs go to the tissues really nicely. So wide tissue distribution and a prolonged effect. So it takes longer for these to leave the system versus hydrophilic drugs, right, which want to be excreted essentially. So in food-producing animals, these drugs are eliminated in the milk, and they require withdrawal time post-administration. So remember, withdrawal time is the amount of time between when a drug is given, or the last time a drug is given, and when that animal's product, be it milk or meat or whatever, can be used in the human food chain. So here's some common ones. Ivermectin. Again, I talked about that. Mostly large animals in severe cases of usually mange, demodectic mange, especially in small animals. And then we have selamectin. That's a Revolution. We're all familiar with Revolution probably by now. Very, very common. Probably one of the best things out there for fleas and cats. And of course also used in dogs. It does have a little bit of a claim for ticks, but it's definitely not our number one choice for that. Milbemycin. So milbemycin oxime, so that's Interceptor. It's also a component of Milbemax. Very, very common small animal dewormer. Works quite well against kind of the usual suspects of the endoparasite world. Moxidectin is the dewormer component of Advantage Multi. So Advantage Multi and Revolution ultimately are very similar products. Advantage Multi uses a couple of different drugs to have the effect that the one drug in Revolution has. Fenbendazole. Fenbendazole is a great dewormer. It's usually available in these big, either powder or a big tub of liquid. It's usually a white liquid called Panicure or Safeguard. It's used to treat things like giardia, lungworm, things that are not easily gotten by the other kind of routine antiparasitics that we use on a monthly basis. So fenbendazole, I'll reach for that if I have something that I think is probably parasitic that's not responding to, like I said, the usual tools that I have. Then there's Fabantal. It's a component of Drontal Plus. I like Drontal Plus. I know Bianca went over that with you because she came in looking for some information on that. So Drontal Plus does kind of everything, including tapeworm. So it's got a couple of different things in it that helps it do that. And then there's albendazole, which is active against nematodes, roundworms, lungworms, and cestodes. What are cestodes? Tapeworm. These are very safe drugs. They can be teratogenic, which means that they can kind of cause changes in kind of cells. They can kind of mutate them a little bit. So teratogenic can happen. I haven't heard of that really, let's be honest. But anyway, there you go. Words of the wise. Pyrental, pomoate, Strongyl T. You'll see pretty much every breeder ever deworms puppies with this. It's a horse dewormer originally. It's not that great against endoparasites. It does kind of some of the nematodes, but it doesn't do anything else. So yeah, it's about 60% effective. It only works against worms that are in the GI tract. So if there's larval stages migrating through the body, it's not going to get them. It has to be repeated 2 or 3 times, or you might as well be just throwing it down the drain. It is used in livestock, again, most commonly in horses. It's not recommended to be used in horses that are going to be eaten. In this part of Canada, I don't think we eat a lot of horses, but in Quebec, I know they do. I don't know where else, that's a real thing. So if horses are going to be eaten, stay away from it, but I think most of you won't be in that situation. I don't see a lot of Strontium tea, honestly, being used in horses these days. There are other products that are just better. Praziquantel, great drug. Dronsit, Drontal, Milbamax, Equimax, these do tapeworms. So I like things that do tapeworms because that makes my life easier. So these are effective against cestodes, tapeworms, and trematodes, which are our flukes. So we worry about flukes. When I think flukes, I think most commonly cattle and sometimes swine. They get liver flukes and stuff. So these are extremely commonly used in cats. So Milbamax is probably the most common cat dewormer because it's so broad spectrum. It gets almost anything that a cat will pick up in terms of worms. So it's still our probably best bet for cats. We used to use Dronsit. Dronsit tastes absolutely terrible. It's a big pill. Try giving this to a cat and it will froth at the mouth for like an hour. It's just not fun. So I used to use Dronsit until Milbamax came along, and I haven't touched it since. So just because I don't like dealing with angry, frothing cats. These drugs can cause vomiting at higher doses, but if you use them as they're prescribed or as they're designed to be used, they're fine. So when we're looking at controlling ectoparasites, there's always a risk of toxicity, so animals have to be closely monitored for toxic effects. The most common means by which we deliver these drugs is by topical application. There are a few different mechanisms of action that these drugs use. There's contact insecticide, so basically the parasite comes into contact with the drug and dies by whatever action. There's agents that target a parasite's nervous system. Basically, usually they paralyze them. So obviously that's not conducive to life. And there are drugs that target the parasite's growth and development. And a lot of these will do things like prevent eggs from hatching, which is what Sentinel does. Birth control for fleas. Those sorts of things. All right. Here's our contact insecticides. Good old Advantix over there. So we have our organophosphates and carbamates. These are used in agriculture. We don't use them in companion animals. They have a very narrow margin of safety. You see toxic effects with these all the time. You have to be really, really careful with these. But they do have a broad spectrum of activity. Fleas, ticks, mites, flies, lice, grubs, pretty much everything. However, again, you will see toxicity, so you won't see these used in small animals, really. So you can see salivation, urination, defecation, depression, twitching, tremors. So basically it's neurological more than anything. Steer clear. If you happen to be working with livestock, well, you might see some of these. I don't think it's common anymore to use these. When I went to school, we learned about organophosphates and carbamates in the context of how to treat toxicities. So that tells you kind of how often they're really used for parasite control. Then we have our pyrethrins and pyrethroids. Canine Advantix and Advantix 2 are permethrin with other ingredients. These are really quite effective, although they are saying that there's starting to be some resistance to these, but quite effective generally against mosquitoes, ticks, flies, and mites. Clinical signs of toxicity in these guys: hyperexcitability, tremors, salivation, weakness. Don't use these in cats. They are highly toxic. So you will see this, unfortunately, most likely if you work in a small animal clinic in your career, you will see permethrin toxicity or pyrethrin toxicity, and it's horrible to see. And I think I actually have a video of it here, so let me just see if we can make this go.
Is this the one where the cat's twitching?
So some more ectoparasite drugs here. Amitraz. This is like collars. There's collars and dips. So an example of this that you will see in clinics is Preventic collars. as of about 3 or 4 years ago, this was our best defense against ticks, and things have come so far. But prevent tick collars are actually they're kind of nice. They do work fairly well, unlike a lot of different kinds of flea collars. However, you have to be really careful if there are cats in the household, if there are children in the household, and these are exposed, there's risks of toxicity to animals or people. So a lot of times what we used to tell people is just get some double-sided tape and tape it to the inside of their regular collar. That way, other kids or other animals are not going to come around and lick it or touch it or whatever. But that's amitraz. Ivermectins, so we've talked about those before, like Revolution or ivermectin. These are effective against fleas, somewhat against ticks. Imidacloprid, that is your flea component of Advantage. And Nitropyram, which is actually a really fantastic drug. It is your Capstar, which of course kills fleas super fast within about 20 to 25 minutes after giving it orally or per rectum. So Capstar is a fantastic drug. There are those new ones out that I don't have details on here, but they are basically as effective as Capstar at killing fleas and last like 3 months, like Bravecto. So that's an amazing tick product right there. I should say that's a tick product, but it does fleas as well. So it's actually very effective. So I would now, if I were recommending anything to my clients for ticks and fleas, that I would now counsel them to get Bravecto. I think that's an amazing product that's really quite new. And then we have our drugs that target, those ones we're targeting the nervous system. These ones target parasite growth and development. So they affect different stages. The most common one in this class is lufenuron. You'll see that in Program and Sentinel. It inhibits chitin synthesis. So that just means that these fleas are not able to develop into adult fleas. There's no side effects, which is always a bonus because it's targeting something that humans don't have and animals don't have. Mammals, let's say. So there you go. Okay, so a client brings her 12-week-old kitten for a wellness exam and a second set of vaccines. The owners notice the kitten scratching a bit more than usual, but says she's seen no evidence of fleas. He seems happy and healthy overall, although the veterinary technician notices that he is a bit thin. The tech asks about the kitten's bowel movements, and the owner recalls seeing whitish flecks in the stool that looked like grains of rice. She then parts the kitten's fur near the base of the tail and sees this. What is that? Flea dirt, flea poop. Yep. What is the significance of this finding? Exactly. The cat has fleas. What could the white flecks in the stool be? Tapeworm segments. Yep. How are those white flecks and the substance seen in the fur connected? So, vector, yeah, intermediate host for. So the fleas have tapeworm. The cat eats the flea and gets tapeworm. That's how that works. So it's not just getting bitten by the flea. That's not how tapeworm is transmitted. The cat has to eat the flea. And cats are always eating fleas. Cats don't like things crawling on them, and they will eat them. So that's how a lot of cats get tapeworm. Do you remember what kind of tapeworm? Have you gone into this yet? What kind of tapeworm?
I think with the rep
Yeah.
started talking about like
Yeah. Different kinds of tapeworms. Well, different. We're going to go over this in the lab procedures, or whatever. But it's a Dipallidium caninum is the kind of tapeworm that you get from fleas. And then we'll outline an appropriate treatment protocol for the kitten, what drugs should be avoided. So here's your answers. Of course, we have flea poop. It indicates a flea infection. The white flecks are tapeworm segments, which of course are the reproductive unit of the tapeworm, just full of eggs. Sad, yucky. I don't like them. Tapeworm infection can be confirmed via a fecal exam, so we do that by fecal flotation, centrifugation, all that stuff that you're going to get familiar with in the next few months. And fleas will carry the tapeworm, which infects the animals when they ingest the flea, so usually came after the flea infection. So there's two components to the parasitic infection here. we have fleas. So we have to treat the fleas. In a cat, there's nothing that's going to get fleas and tapeworms for you. So you kind of have to get two different things and have them go together. So options for fleas would be Revolution is probably your best bet for cats. In general, it seems to work better in cats than anything else. So Revolution for fleas, or you can use Advantage, Advantage Multi, or Program. Program is great for long-term flea protection in cats. It works a lot like Sentinel. It's like birth control for fleas, essentially. You can give an injection. It lasts for 6 months. So if you're looking for long-term protection, say you have a flea allergy cat or something, that's one way you can go. Revolution or Advantage Multi are good for active flea infections. So you repeat it every 4 weeks for at least 3 treatments, and that's really important. If you want to get control of it, you have to treat for three treatments in a row. And then tapeworm. So even if you're using Advantage Multi or Revolution, the active ingredients in there will not kill tapeworm, so you need something else. You need something with praziquantel. So that would be Milbamax, probably your number one best bet. Drontal Plus or Droncit or Profender. Did you guys talk about Profender at all? It's a topical dewormer. It's a great product. I don't know why it never caught on. Maybe it's caught on in some places that I don't know about. But it's a topical dewormer which gets tapeworm, but it doesn't do fleas, right? So I think maybe that's why it didn't catch on. So in this case, I'd probably treat this cat with Milbamax because I want to get that tapeworm, and that's really my best option. And I'd probably give it Revolution because that's best for fleas. And you can give those two together, no problem. Yes, there's an overlap in spectrum of activity, but that doesn't matter. You're not going to cause toxicities that way. Questions? Questions about antiparasitics, or we can go back to anything else.